Welcome to Health Rake Media Channel, where we provide health-related nuggets and answer critical health questions to give valuable guides. Please, subscribe to this channel. Today's question we wish to address is, how long should you do intermittent fasting? Intermittent fasting has become a popular trend in recent years, with many people claiming to have lost weight, improved their overall health, and even increased their lifespan by practicing this type of eating pattern. But, how long should you do intermittent fasting? In this video, we will explore scientific research on the topic and help you determine the best duration for your individual needs. Intermittent fasting is a method of eating in which you cycle between periods of eating and fasting. There are various types of intermittent fasting, including the 16/8 method, where you fast for 16 hours and eat during an 8-hour window. And the 5-2 method, where you eat normally for 5 days and restrict calorie intake for 2 non-consecutive days. According to a study published in the International Journal of Obesity, intermittent fasting can lead to weight loss, improved insulin sensitivity, and a reduction in the risk of chronic diseases such as diabetes and heart disease. The study, which followed 100 obese individuals for 12 weeks, found that those who practiced intermittent fasting lost an average of 7% of their body weight, compared to a 3% loss in the control group. Another study, published in the journal Cell Metabolism, found that intermittent fasting can also have anti-aging effects. The study, which was conducted on mice, found that intermittent fasting increased lifespan by up to 30%. The researchers also found that intermittent fasting improved the function of the mitochondria, the powerhouses of cells, which is thought to be responsible for the anti-aging effects. Intermittent fasting can be a powerful tool for weight loss, improved insulin sensitivity, and a reduction in the risk of chronic diseases such as diabetes and heart disease, says Dr. Jason Fung, MD, a leading expert in the field of intermittent fasting. However, it's important to note that intermittent fasting may not be suitable for everyone. Pregnant women, breastfeeding mothers, and individuals with certain medical conditions such as diabetes should consult with their healthcare provider before starting intermittent fasting. In conclusion, intermittent fasting can be a powerful tool for weight loss, improved insulin sensitivity, and reduced risk of chronic diseases such as diabetes and heart disease. However, the duration of intermittent fasting that is best for you will depend on your individual needs and goals. It is always best to consult your healthcare provider before starting any new eating pattern. Thank you for watching this video. Try to comment below and share this video. Please, don't forget to subscribe to this channel. Thank you once again.